Okay, members, ready to resume the sitting. We will now move to questions to the Minister of Health. Questions 11 and 13 have been withdrawn, and I call Kelly Armstrong. I call Minister.
Mr. Speaker, I would like to request a further minute so that I can provide a full update on this important topic. Trusts proactively identify unpaid carers by working closely with GPs, pharmacists, the community and the voluntary sector and other public agencies. A standard practice when staff identify carers, they are offered carer assessments or reassessments, and if accepted, arrangements are made for the assessments to be carried out. While the impact of the pandemic has yet to be fully quantified and assessed, it is clear that the physical and mental health of our vulnerable adults and carers has been affected as a result of COVID-19 restrictions and the subsequent reduction in adult daycare and short breaks. Adult daycare and short breaks are subject to nationally agreed health protection guidance to keep service users safe. Dynamic risk assessments of each setting and implementation of infection control measures ultimately determine the level at which services can be delivered safely. While services have reduced, just as they have in many neighbouring countries, I, however, am very mindful of what a support they are to service users and families. Members will be aware that the Public Health Agency were tasked to undertake an in-depth review to identify a safe pathway to restore services fully. This was formally submitted to the Department at the end of October last year, and consideration of the pathway was required to take account of the evolving evidence on the Omicron variant in terms of transmission, virulence and vaccine escape. The risk of COVID-19 transmission must, however, be balanced against the health and well-being of carers and have received a partial service for nearly 2 years. That is why I have approved in full the pathway for the remobilisation of adult daycare short breaks and transport. My officials have now written to health trusts to direct the full implementation of the pathway, and I expect trusts to act without delay. Trusts will be able to use the pathway as an enabler to scale up services in a holistic manner to manage risks, and trusts will be required to update rebuild plans and outline the time frame to fully restore respite services. And I would like to personally thank the families that have shaped this pathway through the engagement panel facilitated by the Patient Client Council, and the review and pathway will be placed on my department's website.
Kelly Armstrong, supplementary.
Thank you, Mr. Speaker, and thank you, Minister. You've taken the wind out of my sails, because I was just going to ask you about the restoration document. Can I just say this is absolutely welcome news for all of those carers out there who are exhausted and have been waiting for daycare and respite care to come back. Minister, on that, that's all I'm going to say. Thank you very much.
I call Colm Giller now.
Sorry.
Mr. Speaker, no, look, in regards
you're responding to a non-question, but anyway, respond.
That many carers and family members have received due to the reduction in services of adult daycare, short breaks and transport. It has been something that the member has raised numerous times within this chamber, and I gave her my commitment any time she did raise it that we would look at the remobilisation of those. The pathway has been published. It doesn't mean we will go straight to full delivery straight away, but it does set a pathway to allow our trusts and service providers to get there.
I call Colm Giller now.
Minister, I also welcome your commitment, but I would like to know if you could outline for us the timeline, because these families are already extremely hard pressed. So could you give definitive times for when families will have the services restored?
And I thank the chair of the committee for that point. As I said, the pathway has been agreed today. My officials will now write to all trusts to direct the full implementation of the pathway, and I expect trusts to act without delay, so the operational delivery will be with trusts.
Call Palm Cameron.
Thank you, Mr. Speaker, and thank the Minister for his very welcome announcement on that answer to Kelly Armstrong's question. Pre-pandemic, families have had to wait some time before receiving a respite care package, and this waiting list for support is undoubtedly growing. So what steps has the Minister taken to ensure that once respite services have been properly restored, that they will have the capacity to meet the increased demand?
And I thank the member for the point, because it's not just because of COVID we were in the situation we currently are, but the challenges were already there before COVID. Currently, trusts are at a varying level of adult daycare provision pre-pandemic, between 50 and 60% of capacity, and trusts have reported significant reduced access to community short breaks and transport provision. and that's reflective of the availability of physical space and the use of independent sector contracts. So trusts are exploring a range of options to further increase the level and range of services that they can provide. Whilst this currently has resulted in nominal increases to provision, a change in policy is required to restore services to pre-pandemic levels. And furthermore, as I said, the trusts have now been instructed to get on with the job and to implement the pathway, and trusts will be required to set out updated rebuild plans to outline a time frame to fully restore daycare, short breaks and transport.
Call Dolores Kelly.
Mr Speaker, as a former rehabilitation daycare services manager, the centres provided much more than respite. There also was intervention in terms of post-illness or disability. So are there going to be additional resources in terms of the allied health professionals going into the rehabilitation centres to enable clients to actually maximise their opportunities?
And I thank the member for that. She will be aware there is a consultation currently out in regards to social care provision for the adult services, and I would encourage the member to make sure her views and her opinions are fully recorded in that consultation as well, to make sure that what services are being delivered in every setting meets the needs of those who are using them.
Call Trevor Lunn.
Speaker, question number 2.
I thank the member for his question. As members will be aware, a regional trauma network was included as part of the Stormont House Agreement in recognition of the need for a comprehensive trauma service to better support victims and survivors. Whilst there may have been some debate previously as to what exactly was meant by this, from taking up this office I have been clear with my officials that I wanted to see a scheme developed as initially envisaged. It was a clear political commitment, and it was something that victims and survivors undoubtedly deserve and require. A range of preparatory work to enable the delivery of this important service has been undertaken, and to date this has involved the commissioning of research into best practice on appropriate therapies, conducting training and establishing key clinical and administrative posts within the Health and Social Care Board and trusts. Whilst there were a small number of outstanding issues to resolve, not least varying legal arguments to consider, I am pleased to be able to advise that my officials have been working diligently, and I expect to be presented with a final proposal within days. And it will be my hope to have the service operational as quickly as possible thereafter.
Supplementary, Trevor Lunn.
I thank the Minister for his answer. This question arose out of a meeting between the Executive Committee and the Victim and Survivors Forum last week, and they expressed their utter frustration that, having listened to an blaze of publicity and the announcement of this centre to be established back in 2005, September 2005, by a previous minister, that nothing seems to have happened between that and when this minister took over. So I'm glad to hear that he's announcing some progress now. Can he give us any kind of a timescale or any substantial progress that has been made? And is there perhaps provision in the increased budget that he's going to have to deal with, or somebody else perhaps, that could allow this to proceed with a bit more speed?
To be making a fuller announcement in the next few days, as I said in the substantive answer as well. But I will say, in regards to the design of the services, an important part of establishing the regional trauma network was actually the co-design of services with stakeholders, and that included victims and survivors, the community and voluntary sector, and the Health and Social Care Board. So I wanted to ensure that the respective views of stakeholders actually influenced the nature and direction of the network, because that's integral to the development of an effective and world-leading psychological trauma service. But there was also a number of legal questions also needed answered before we could make progress.
Nicola Leah Flynn.
I can call you, and again thank the Minister for which is, I think, a positive response in relation to Mr Dixon's question, Mr Lunn's question. I was actually going to ask the same issue if the service was being established as it was originally envisaged, and that was obviously a regional accessible service for victims. So I thank the Minister for that response. And maybe just, Minister, you mentioned that some of the detail you have been carrying out around the design and the training and some of that preparatory work. Would the Minister be able to provide some of that detail in writing following on from today's question time? But I think that will be positive news to the victims. Thank you.
And I thank the member for a follow-up question in regards to, I know Mr Lunn also asked about the funding, which I think Ms Flynn also intimated to as well. Figures from the Health and Social Care Board indicated the Regional Trauma Network now receives recurrent annual funding of circa 3.3 million, with the full amount of funding received having been allocated. This funding has been used to establish the regional staff team with a clinical director and operational support functions, and clinical administrative roles have been funded across the 5 health and social care trusts. Funding to date has been used for research into best practice on appropriate therapies, and that included a scoping review with recommendations from Queen's University Belfast, training trust staff and the provision of consultation services, the promotion of the Health and Social Care Board's Compassionate Leadership Initiative, and the innovative web-based information management software.
They call Mike Nesbitt.
Thank you, Mr. Speaker, and I welcome the Minister's remarks so far. As he indicated some time ago, there was, to my mind, shocking, unnecessary and unfortunate confusion over what was agreed politically about this regional trauma network. So I welcome the Minister's commitment, which I reiterate. We will not leave behind the innocent victims and survivors who know exactly what they were promised during the Stormont House negotiations. As the Minister has covered co-design, could he give us his assessment of the importance and the focus on mental health in his department under his watch?
And, I thank the member for that point, and I think it has been well iterated even through the mental health strategy and work programme that we published for 2021 through to 2031. As the member is fully aware, that strategy's vision for the future states that we aspire to have mental health services that are compassionate and able to recognise and address the effects of trauma, with a specific strategic outcome being the facilitation of a trauma-informed practice through targeted approaches to people with a specific trauma exposure. And that has been endemic, I think, and embedded in through the work of my department since I've taken up this role.
Call Cara Hunter.
Thank you, Mr. Speaker. I'd like to thank the Minister for his answer so far and the member who brought this important question forward. Minister, can you outline how the Victims and Survivors NI will work with the Regional Trauma Network? And I recently attended a meeting in Claudy with the Victims and Survivors, and note the incredible support that they provide victims of trauma. Thank you.
And I thank the member for that point, because there is a number of key stakeholders who have been instrumental to getting us to where we are today through the engagement with my officials and the Health and Social Care Board. And as I indicated in an earlier answer, the co-design of the trauma services was an important part of actually establishing the Regional Trauma Network, and it's that co-design that involves not just, well, it involves stakeholders, and that included victims and survivors, the community and voluntary sector, and the Health and Social Care Board. So it was important that the respective views of all those groups were actually taken on board to influence not just the nature but also the direction of the network, as we make sure it was actually fit for service. And it was the Health and Social Care Board has completed a public consultation on the establishment of the Regional Trauma Network, and my department continues to ensure that work towards establishing the network is consultative and participatory.
Stuart Dixon.
Question number 3.
First of all, Mr. Speaker, I'd like to take this opportunity to express my heartfelt condolences to the friends and family of little Maggie Black. One can only but imagine the sense of shock and loss that her family and the wider Carnlough community had experienced over these last 2 months. However, in their grief, they are still finding the strength to campaign for greater emergency medical cover in rural communities. I'm sure I speak for all in this House when I commend them for their efforts and their selfless determination. In response to the question, Mr. Speaker, I am pleased that over recent times there has been much greater collaboration between healthcare providers and the Northern Ireland Fire and Rescue Service. One of the most recent examples were firefighters providing driving assistance to the ambulance service in light of sustained workforce pressures. However, do I believe there could be greater collaboration? Yes, I do, Mr. Speaker. Members may be aware that the Fire and Rescue Service were previously involved in a co-responder pilot where crews were dispatched to cardiac arrest calls. This proved successful in improving response times and was something that last year I had asked to be explored for further rollout. The recent loss, however, has brought it into sharp focus and a renewed sense of determination on my part. Whilst there's still some final work to be done, I do hope to be able to announce details again in the very near future.
Supplementary, Stuart Dixon.
Thank you, Mr. Speaker. Thank you, Minister. Minister, can I ask you today, have you reached out to Maggie Black's family and friends in respect of a meeting which they would like to have with you to explore these issues? And in particular, in relation to your answer today, can I call on you to put on a secure footing that co-responder trial, and that we can actually deliver a co-responder service not only in rural areas but in any area of Northern Ireland where that is a relevant thing for the Northern Ireland Fire and Service and Rescue Service and the Northern Ireland Ambulance Service to do together? And can we ensure that there's a great deal of upskilling?
And I thank the member. I have recently received an invite to meet with the family, and I'd be willing to take it up if the member wants to also be in touch with my office and we can coordinate something at that point as well. Because the ambulance services have, as I say, have previously engaged with the fire service, rescue service on a co-responder pilot where their crews were dispatched to cardiac arrest calls in the local catchment areas of fire stations. This provided successful and improving response but required further engagement with the Fire Brigade Union before it could be adopted more widely. Northern Ireland Ambulance Service Senior Management held a meeting in November last year with their counterparts in the Northern Ireland Fire and Rescue Service to explore how this could be rolled out across all of Northern Ireland. And discussions between the Northern Ireland Fire and Rescue Service, Northern Ireland Ambulance Service and representative bodies for collaboration in an emergency medical response are ongoing, and I will be meeting with the Northern Ireland Fire and Rescue Service Chief Fire Officer and Chair early next month.
Call Robbie Butler.
Thank you, Mr. Speaker. Thank the Minister for his answer, and also like to add my name to the family of Maggie Black, who have suffered and put their grief into good work to try and see this through. I'm sure the Minister would agree with me that for many years the Northern Ireland Fire and Rescue Service haven't been an early response to emergency incidents, have had their hands on victims of many different types of incidents. Would the Minister just agree with me that there are many aspects of collaboration that could be explored through this potential arrangement and on the learning that has went on over this past 20 and 30 years from the first-class response that they provide for Northern Ireland?
I thank the member for his question, and as he will be aware, I think one of the things that makes us unique here in Northern Ireland is the fact that the Northern Ireland Fire and Rescue Service actually sit under the Department of Health. And when I've engaged with the Chair or the relevant Chief Fire Officers, they do see a natural fit for their services and what they can do additionally as actually being part of our community responders in the first response. So we have engaged, as I said, with them. The Northern Ireland Ambulance Services engages with and dispatches multiple community responder schemes as well across Northern Ireland. And we do want to work closely and make sure there is a synergy between what services and supports that the Northern Ireland Fire and Rescue Service can provide to their counterparts and their compatriots in the Northern Ireland Ambulance Service.
Colin McGrath.
Mr. Speaker, I welcome the answers that the Minister has given so far to what seems to be quite a logical process. I know that certainly within the area that I cover, through no fault of the ambulance service, you could be waiting up to 18 or 20 minutes for an ambulance to arrive in a 999 scenario, yet there are part-time fire stations which can have 6 paramedics rolling out within a matter of minutes and could help. But I wanted to ask, has the Minister any understanding of the work that takes place in Dublin Fire and Rescue Service, where that service, that co-response already exists? I'm meeting with the Chief Fire Officer in Dublin on Friday, and I would welcome that if the Minister felt that it was useful, if we could have some follow-up meetings with departmental officials to try and roll this out.
In regards to taking this forward, Mr. Speaker, it's the engagement that I've had with our new Chief Fire and Rescue Officer, who is also a driving force between what additional services the Northern Ireland Fire Brigade can bring. So he does bring experience from previous roles that he understands the challenges but also the opportunities that there are in additionality to what the Northern Ireland Fire and Rescue Service can actually provide. So those conversations are going, and as I indicated earlier on, I will be meeting with the Northern Ireland Fire and Rescue Service, the Chief Fire Officer and the Chair early next month.
I call Anya Murphy.
And I'd like to thank the Minister for his answers thus far. Minister, rural communities are experiencing a significant deficit of public services, not least in terms of life-saving services. What plans has your department in place currently to address the lack of fire cover and ambulance provision in rural areas?
The member may or may not be aware that currently the Northern Ireland Fire and Rescue Service actually has a public consultation out at the moment as to how they restructure their management sectors, and they're actually looking to map those on top of our local district council levels as well, something that wasn't done previously when the new councils were set up. But there is a consultation out in regards so that the Northern Ireland Fire and Rescue Service can actually follow those boundaries as well. Mr. Speaker, it was co-terminosity was a great phrase and a great word that was used at a time and seems to have slipped out, but it's something that the Northern Ireland Fire and Rescue Service are now progressing with.
I call Mervyn Story.
4, Mr. Speaker.
And I thank the member for his question. The Delivering Together was published in 2016 in response to the Bangor report, and in response to huge strategic challenges, including an ageing population, continued increase in demand, long-growing waiting lists, workforce pressures, the emergence of new and more expensive treatments and ongoing budget constraints. Delivering Together presented a new strategic direction to transform health and social care services, both in delivery and in planning. COVID-19 has further reinforced the need for the transformation of our system, as highlighted throughout the Bangor report, and that includes in consideration of how our hospitals are configured, including the number of acute hospitals. Work is underway to consider our urgent and emergency care services, to improve our elective care work and consider the provision of general surgery, all which are areas which have a direct impact on the number of acute hospitals. I do not have the overall direction of travel as of yet, and it would not be right for me to assume outcome of the work that is currently ongoing. However, it is safe to say that with the increase in population need for health and social care services, I do not envisage closure of hospitals, as we will need to maintain capacity. Going forward, the outcome of the ongoing reviews and reforms are likely in order to reconfigure where specific services are delivered, such as envisaged in the elective care framework in terms of elective care sites. This will, of course, have an impact on the number of acute hospitals. However, whilst the pandemic has provided challenges to our ways of working, it has, by necessity, also slowed down our progress of transformation. The work to reform services is being undertaken in very difficult circumstances, and the professionals providing the expertise to my officials are the same staff standing in the front lines across the trusts. Nevertheless, Health and Wellbeing 2026 Delivering Together remains the overarching strategy for transforming health and social care services, and decisions on the nature and approach to rebuilding services will be considered in adherence to the principles set out within this strategy. And as we rebuild our health and social care services, the transformation will continue and remains a priority and the only solution to the long-term sustainability of our system.
Thank you, Carl Mervyn Story for supplementary.
Thank you, Mr. Speaker. Obviously, anyone listening to the response by the Minister will yet again indicate that it is littered with ambiguity and uncertainty. On one hand, the Minister says that there will be no closures. On the next hand, he then makes reference to have an impact on acute hospital provision. Can the Minister give a clear assurance in this House that the Causeway Hospital, that has done a huge job during the pandemic, without which we could not have had provision of service, will not have its future questioned in the overarching strategy, which seems to be the focus of this Minister?
I don't know where the member has got that information from, because I've always been clear in this House that we need every square foot of our hospital provision, and the member has heard me say that many times, so I can assure any member in this House. And I've heard members recently on social media and print media talking about the closures of hospitals and the threats to hospitals. No such thing. No such thing has happened or even been intimated under my stewardship of this ministry, because we need every bit of our hospital estate. Actually, we need to invest more in our hospital estate, and the member will be well aware of the support that Causeway Hospital has received, and he'll know well, being a fellow MLA for North Antrim, that in the past, where there were those who talked about the threat to Causeway and it was going to close, were actually the ones who were driving it down the road of closure, because it made it so much harder for the management and the staff, not just of the hospital, but of the Northern Trust, actually to recruit. And when the narrative around Causeway changed, that it was an integral part, not just to the Northern Trust, but also to the entire health estate, it made it easier for the management within the Northern Trust actually to recruit and put that hospital on a firmer basis.
Call Caroline Cullen.
Good Concollia, and I'm delighted to hear the Minister saying that about the matter. I agree. You need to love your hospital, try and save them. Sends out the wrong message. Given the impact of retention and recruitment of staff that was there before COVID, certainly everybody, including the Minister, will know full well that certainly with the retention of staff and workforce planning is key. Can the Minister confirm if he's planning to bring additional plans and strategies forward around the retention and recruitment staff as part of the overall workforce planning piece? Cormagat.
And I thank the member, and she is right, it's about how you frame your support for your local health service. When people undermine it and they talk about a closure, it actually unnerves staff and unsettles staff. She will also be aware that my department published the Comprehensive Health and Social Care Workforce Strategy 2026, delivering for our people. Originally had been envisaged that 3 consecutive action plans would be developed during the lifetime of that strategy. The first action plan was to cover 2018 to 2020. Our pandemic response delayed the formal development of the second action plan. However, a number of actions were progressed in 2021. But effective workforce planning is a key theme of the workforce strategy, with the aim of developing by 2026 sustainably funding an optimum workforce model for the reconfiguration of health and social care services. And operational workforce planning is the responsibility of the employers, such as the trusts and other parts of the workforce. Long-term regional workforce planning is led by my department, and it is aimed to secure a workforce and skill supply over the next 5 to 10 years horizon. So the concentration and the focus now, and the members heard me say this, when we used to talk about recruitment and retention, it was all under one framework, but what we've done since the middle of last year is actually split those. So while we look about recruitment, we also look at retention as a separate piece of work, and the member will be aware through briefings to the Health Committee of the work that has been specifically led around our nursing and midwifery workforce at this minute in time.
Call Paula Bradshaw.
Thank you, Mr. Speaker, and thank you, Minister, for your answers so far. The Bingoa report was 2016, and we were all very excited when it came into force, and then your department released its response, so to speak. Are you going to produce an updated version of that off the back of the COVID pandemic, and how you integrate the putback with the transformation agenda? Thank you.
I thank the member. There is an intention to go down that and produce an updated report in regards to that direction of travel, and the member will be aware that in regards to the elective care strategy, mental health strategy, cancer strategy, a lot of that work is actually different work streams of what needs to be done to be rebuilding that as well. So when we have the capacity and the headroom within the department, we'll produce such a report as the member is talking about.
Well, Jim Allister.
Minister, clarify, is it still the situation that if a board announced a temporary closure, it doesn't require a public consultation, but a permanent closure does? And we all had experience of that a decade ago when Belfast City Hospital Emergency Department was declared temporarily closed, allegedly. Is that a ploy which is still used, and has that been last week we had an indication about Daisy Hill? So what is the position between is there consultation on temporary closures or not?
The member will be aware, I'm sure if he's followed, the Trust has said they will go out to consultation in regards to Daisy Hill, but he will also be aware of the reason why the board made that decision, that out of 6 substantive posts, they only had 2 general surgeons actually in place, and one of those was due to retire. So the steps that were actually taken was due to safety measures agreed by the board and then recommended to the Health and Social Care Board.
That ends the period for list of questions, members, and we will now move on to 15 minutes of topical questions. Topical question 6 on data being withdrawn. I call Padraig Delargy.
Minister, what steps is your department taking to ensure that all patients have timely access to GP appointments?
I thank the member for his question in regards to GP services. There was an adjournment debate in here a couple of weeks ago in regards to the overall provision about what additional supports and measures are actually being put into our GP services in regards to additional fundings to ease them, support them over the winter pressures, but also additional monies that they can put actually into their telephone services as well, so they can make sure that they can see as many patients as needs to be seen, but also they can get as many telephone or online consultations to those patients where that's suitable as well.
Supplementary.
Thank the Minister for his answer so far. Obviously, one of the most, I suppose, distressing parts of this, particularly for people who need an appointment before they can access surgery or where chronic illnesses can be diagnosed, is that they're contacting the surgery numerous times. They're only ever getting as far as the reception desk. They're not getting past that, and it's very frustrating. It's only adding to the anxiety which patients are experiencing. So would you be able to outline what measures you're taking specifically to address this issue, particularly for patients who need a GP appointment urgently so that they can actually get one when they get through to their clinic?
If the member has a specific clinic he wants to raise with me in regards to the challenges that are there, because I do know the issue that he raises has been talked about in a number of areas, but often when I talk to our Royal College of GPs or the GP Committee of Northern Ireland, it is a very small number of practices where that would be the general experience as well, because our GPs are doing over and above in regards to their own hours, but also making sure that anybody who contacts their surgery is actually either receiving a call back in regards to an appointment and been given that opportunity, or are being seen face to face as well. So if there is a specific practice that the member has concerns about, if he wants to let me know about it, I'll raise it with them.
Call Paul Frew.
Speaker, when asked by a member of this House on the 25th of January to confirm that he, the Health Minister, would be bringing a motion to extend his emergency powers, the Minister said that it would be up to the Business Committee and he wouldn't want to preempt what decision that they would take that day. Mr. Speaker, a very strange response when we know the Business Office placed the extension of powers motion onto the provisional order paper twice, once on the Tuesday the 25th of January and then again on Monday the 31st of January, which is today. Can the Minister confirm to this House that it was him, that withdrew the motion twice? And can he give this House the reasons why he withdrew the motions?
I thank the member. Quite simply, yes. I withdrew the motion because it still needed to be clarified as to what steps the Executive were going to take on the 10th of February. And I thought it would be premature to debate something that hadn't been passed through the Executive. But what I will note, Mr. Speaker, was it was the provisional draft paper that indicated that debate. And I had wrote to the Business Committee asking for that motion to be withdrawn on that Tuesday. The Business Committee hadn't met. So when I answered Mr. Allister, at that point in time, the Business Committee had not given me indication that that debate would not proceed. So I didn't want to preempt the decision of the Business Committee.
Okay, I call Joanne Bundy. Oh, sorry. Paul Frew, supplementary.
Thank you, Mr. Speaker. I hope you wouldn't deny me a supplementary. The Minister, thanks very much, Minister, for confirming that you withdrew the motions twice. And the reasons you give is a bit strange in itself, because no matter what decisions are taken on the 10th of February, the motion to extend the powers is about the ability to use emergency powers in the future. So there isn't really a connection between the 10th of February decisions to be made and an extension of your power, Minister. So can I ask again, why do you need the extension of powers, and when will you bring it to the House to debate fully?
And again, I thought I had explained to the member before in this House, they're not my powers that I seek to extend, but the powers of the Executive. because it's the executive that makes the decisions in regards to any extension or any motion that is brought to this House in regards to restrictions or regulations. So I wanted to make sure that I was in full capacity of what the executive intended to do on the 10th of February before I brought a debate to this House in regards to the fullness of what powers would be extended at the request of the executive.
I call Joanne Bunting.
Thank you, Mr. Speaker. The care package crisis carries on, you'll be aware. So could I ask the Minister what action he's taking to ensure that those who are awaiting a care package in order to be discharged from hospital will be afforded access to such package within a timely manner?
I thank the member, and she will be aware that I gave an additional £23 million to our domiciliary and care providers towards the end of last year, so they could increase both capacity of provision but also workforce as well. And Mr. Speaker, although that money was given at the end of, this end of November, started December, it is taken with actually within the last few weeks that we're actually seeing those additional places, those additional recruitment processes coming into place to provide for the additional packages to be brought in as well, and for the additional people to be supported in the discharge and the supported discharge from hospitals as well.
Joanne Bunting, supplementary.
Mr. Speaker, I have constituents who are elderly, who are terminally ill, and whose families made the difficult decision to bring them out of hospital prior to Christmas, and those people are still awaiting care packages. Could I ask the Minister, therefore, do we need to step this up a gear? What can be done as a matter of urgency to introduce more staff into the sector to try to address this before it becomes a worsened and heightened crisis?
And I thank the member for her point. She will be aware that there was an announcement even made last week of one care provider actually recruiting an additional 300 places across Northern Ireland to be able to support these packages and additionality as well. So it is about actually supporting those independent and trusts who are still recruiting and who are actively recruiting to fill domiciliary care places at this minute in time, to encourage people to come forward because of the additionality of the increased pay rates that were able to be put into place due to the additional monies that were actually provided towards the end of last year.
Call Pat Kennedy.
Thank you, Mr. Speaker, and thank you, Minister. Minister, in a letter addressed to myself and indeed the Education Committee, you outlined to this House and to myself why you feel the free provision of period products is not a health issue.
I thank the member, and he will be aware that also in that letter as well I indicated that while period poverty is a very serious issue and the lack of access to period products can have significant consequences, we can all agree that the statistics that 40% of girls report having used toilet paper because they couldn't afford the products is shocking, or that it is very wrong that mothers have to choose between products or feeding their children. And the lack of period products can also have a negative impact on a person's health, both physical and mental. And tackling period poverty is therefore an important issue and something that must continue. I'm aware of the bill to provide free period products. The bill would provide a scheme for my department to provide free products to anyone who is in Northern Ireland, and I very much recognise and share the objective of the broad intent of the bill. However, period products are not classified as healthcare products, as menstruation is neither an issue that in general requires health treatment nor is preventable, and the undeniable health impacts does also not make the underlying issue and the lack of period products a healthcare issue. Rather, I believe that this is an issue closely related to poverty, social justice and gender equality, all of which are outside the remit of my department. And as such, whilst I do very much welcome the underlying principle in the bill, I'm unable to support the duty solely on my department.
Supplementary, Pat Kennedy.
Thank you, Minister, and you'll know that I don't agree with you on that. And Minister, as you know, your department provided free condoms under the C-card scheme, yet period products are not a health issue. Does the Minister not feel that this is unfair? And Minister, what can you do within your powers to rectify this?
The member will be aware as well, although this is currently in consideration stage at the Education Committee, and he indicates the response that I give. It was also, I have also written to my executive colleagues to get agreement on which department should lead this work. And without such agreement, no executive amendments can be proposed to the bill, both in relation to the responsible department and in relation to other technical issues that are presented in the bill. And this leaves my department open to the risk that the duty will be placed, even though the issue would normally be outside our remit as well. So why I do support the member and the intent of his private member's bill as well. The sole responsibility and the financial implications resting solely on the Health Department is not something that I can accept, and I know that's where the members come from. But I will gladly support this being taken forward by executive departments or even the executive office in regards to who takes ownership of the member's bill.
I call Mervyn Storey.
Minister, in a recent meeting of the Community Pharmacy All-Party Working Group, I made the comment that platitudes will fail to deliver for patients who are currently not in receipt of the Medicine Advice Service. Given the fact that you know that there's been a commitment, a huge commitment by our community pharmacists, when will you move to make medicine adherence services a non-commissioned service and end the current situation where new patients cannot be brought into this service?
My department has been working both with the Health and Social Care Board and Community Pharmacy, who the members said they had met with, and that's in the development of a commissioning plan for community pharmacy services. And in 2021-22, the focus was on the provision of core services. That included dispensing, repeat dispensing and adherence, and some activities and services that ensured access to medicines and advice for the public, including vulnerable groups and those receiving end-of-life care, because that ensured that local pharmacy services were available to meet the needs of the people of Northern Ireland and to support the pressures within our health and social care services. CPNI and the Health and Social Care Board have now agreed a commissioning plan for the next 3 years that will cover 2022 to 25, and subject to the agreement of a funding envelope, the 3-year plan will aim to consolidate and build on the considerable advances seen in community pharmacy services and the role of local pharmacists and pharmacy teams that the population have benefited from over the past 2 years. So in looking to the future, it is important that we continue to work together to build on the significant successes that community pharmacy has had and continues to have.
And Mervyn Storey, supplementary.
Speaker, given that this was an issue particularly relevant during the pandemic, there was COVID monies that were made available. The Minister has made reference to a funding envelope. The Minister has received money. When will he use that money to actually deliver this service?
On the wider scheme, the service that the member talks about will be part of the 2022-25 funding package that already is agreed, and the funding envelope of that is will be part of the overall Department of Health budget as well. In regards to actually providing that service between the 1st of December to the end of March, there was a £5 million offer made, which unfortunately wasn't acceptable to community pharmacy, but at that stage my department officials, Health and Social Care Board and Community Pharmacy continued to work together to try to bring about a resolution to what has been a long-running dispute in regards to this specific one service.
I call Just McNulty, and the member's unlikely to get a supplementary.
Minister, why is Daisy Hill Hospital and the community our wonderful hospital serves always the last to get and the first to lose?
Mr. Speaker, that's not the case in regards to Daisy Hill Hospital. I know it is the case that the member has tried to portray in the media. I think it's unfortunate. I think he's undermining the service. I think he's undermining the hospital and the work that they are trying to do. And I'm aware, Mr. Speaker, that the member and some of his party colleagues have taken to social media to point that out. And I'd also acknowledge the responses that have come back from Mark Taylor, the Northern Ireland Director of the Royal College of Surgeons, of Alan Stout, the Chair of the Northern Ireland GP Committee as well, in regards to actually asking the member and his party colleagues to be careful. And the word was, be careful what you're petitioning for, because it's the safe service in Daisy Hill that is the priority. It's about high-quality general surgery for all patients in the area, and general surgery has changed throughout the UK and needs major support, so it doesn't need the undermining that the member seems to be building up for in his campaign and even in the letter that he wrote to me back on the 14th of January, where he talked about pursuing alternative avenues to oppose any and all proposals to scale back or downgrade Daisy Hill Hospital. There is no such proposal.
And members, time is up, and members, please take your ease for a moment or two.